Hello everyone. I want to reach out to the Franklin Schools community as well as the Franklin community to talk about what we're doing in this unprecedented era of COVID-19 and trying to be proactive and create social distancing so that we can allow the medical community and the entire community to move forward. So today we have two guests with me. We have Mayor Barnett, who's going to talk about the city of Franklin and the partnerships that are created both in the school and in the city. And then we have Dr. Mormon, who's going to speak on behalf of Johnson County Health and his expertise as we move forward together, because he really ends up being a very key figure throughout this journey for the entire community. So thank you for coming today. First, we're going to, Mayor, why don't you talk about what the city's doing and what the partnerships you've created?
First off, Mayor Steve Barnett, City of Franklin. Our safety is our number one priority, and we really enjoy our partnership of working with the state and local health officials, working with the school. But the city and all of our staff want to be proactive in fighting this virus that's there. I will say that there is no confirmed cases in Franklin yet, but we want to make sure that we combat this when and if it does come. One thing that we are doing, we're shutting down as of today our active adult center. I think our active adults, the seniors, is probably the biggest worry that we have. That's what we've been told by all our health officials. Another concern we have with that, and our staff is still going to be at the active adult center. We have a lot of active adults that rely on maybe having one meal a day there. So we will, as a city, be reaching out to those seniors that come there every day. We also have our Franklin Township trustee who wants to work to make sure our seniors is fed. Our seniors is a big concern of ours. Another thing that we're doing to be proactive, we're going to go ahead and close our rec center until after April 6th, and then we're going to reevaluate April 6th on what we will do there. Hopefully we can get this behind us, but if not, we're prepared to extend it on out a little bit longer. Also, we want to cut back on some of the connectivity with some of the citizens. So with our public offices, we're not shutting down our business. We're still going to be carrying on business as usual. However, we're going to ask that we do more stuff online, we do more stuff by telephone, and kind of cut out a little bit of the social contact that we have. So that's what we're doing to get through this, try to help, and looking forward to listening to our health officials telling us it's getting better.
Yeah, I'm looking forward to that too. Hi, I'm Craig Mormon. I'm a pediatrician in Franklin and also the Johnson County Health Officer. And first of all, I know everybody's concerned, worried, nervous, scared, and it's a frightening illness, and we know that it's going to get worse. There's only 12 cases now in the state. None in Franklin, like was said, but we know it's going to get worse. So we're taking proactive steps to try to limit the spread. I don't think we're going to be able to control it completely, but we want to protect people from getting seriously ill and limit the spread so that we don't have, our system doesn't get overwhelmed with ill people. The key is to stay calm, don't panic. We're going to make it through this. So number one, if you're sick, stay home. If you're coughing, got a fever, don't go to work. Stay home. Don't go out and run around and cough on people. Call your healthcare provider too and get some guidance. Chances are it may be the flu. We're seeing a lot of influenza still. Wash your hands a lot. I'm sure everybody's tired of that. Soap and water is great. If you have a hand cleaner, terrific. But just wash your hands a lot more than you used to do, and then you'll probably have to use some lotion because your hands will dry out like mine. So these closings, I know it seems extreme, and there's a huge burden on families, financially and otherwise, but I think it's very proactive, and we want to eliminate the spread. We know right now the risk is really low for residents of Johnson County, but we're trying to limit the risk. And the key, the spirit behind all these closings is social distancing, and that's a key message. Just because now you're out of school, you need to eliminate some of the big gatherings and group activities, and that's the whole idea, social distancing. So that's why we're doing this. We're going to make it through. The key is to protect yourself, your family. our key priority is the elderly. They seem to be extra vulnerable, so they are already in seriously restricted environments and protected, and we hope we can keep them healthy. And the bottom line is stay tuned. The best source of information is either the CDC website or the Indiana State Department of Health website. They have daily updates. It's a great resource. I'd stay away from social media for the most part, and those are the two best sources of information. So the key is we're going to make it through this.
Thank you, Dr. Mormon and Mayor Barnett. So we've heard a lot about the partnership. So what are we doing in our school system? We are being very proactive in this situation. We are in school today, but starting Monday, March 16th through April the 5th, we're going to be out of school. We're going to spend the first 9 days in home learning. It is different than e-learning. Home learning, more expectations on our students to plug in with their teachers, do their homework, and make sure the learning continues for the next 9 days. And then we're going to have spring break. We know that spring break has nothing, the virus has nothing on spring break. We know that's just a date and time that we've set. So we're going to monitor the data, and on April the 1st, we will make a decision about the next week. I know there's been a lot of questions. Why didn't we go ahead and use waiver days that Governor Holcomb provided last night? For Franklin schools, we are looked to the authorities, and I think that right now we're hearing it's going to intensify before it subsides. And based on that information, I wanted to have the flexibility that in April that we could invoke our waiver days and still keep learning moving forward in the present situation. So that's why we decided to do 9 days of home learning. We also want to make sure that it works. We want to see what issues come up with home learning, what things are really good, and what things do we need to tweak as we think about our systemic thinking and how we do life. Also want to announce that there'll be no after-school activities effective today through April 6th. So all sporting events, all team practices, everything will stop, and once again, is to create that social distancing. We want to make sure that everybody's safe. We want to make sure that the medical community has all the things that they need in order to keep the community safe. And this is one way that Franklin schools can help and participate and be a good partner. Parents, we know there's going to be a burden. We understand that some people are thinking, how am I going to get food? What am I going to do? We are meeting with local clergy, the city, and making sure that we provide food opportunities for our students during this time. We will be offering lunch for students, and I'll get more information out that today and this weekend as we move forward for the next 3 weeks of school. If you have questions, please make sure you reach out to someone in the 3 offices here. But more importantly, we want to make sure that everyone does remain calm. That remember, Franklin is a great place to live and work and play. And in this unprecedented time, I'm sure glad that I'm standing beside great leaders who can make a difference in the community and calm everybody down and know that we're going to be okay. So with that, thank you for watching. If you have any questions, please reach out.